Hello students, the topic we are going to cover today is another developmental anomaly affecting the tongue. The last topic we covered was fisher tongue. So today we are going to refer to geographic tongue, which is also known as benign migratory glossitis. So as the name suggests, the benign means any condition which is not malignant or which cannot spread and which is harmless. Migratory is obviously literally a term which means ki a condition which can migrate, which is not stable, and glossitis is something which shines. So, benign migratory glossitis is a psoriasis-form mucositis of the dorsum of the tongue, which means it affects the dorsal surface of the tongue. Psoriasis-form mucositis means any disease which is associated with a cutaneous disease of the skin named psoriasis, and mucositis means it's a kind of inflammation of the mucosa. सो इसका डोमिनेंट कैरेक्टरिस्टिक होता है अ कॉन्स्टेंटली चेंजिंग पैटर्न ऑफ द सर्पिजिनियस वाइट लाइन सराउंडिंग द एरियाज ऑफ स्मूथ depapillated mucosa. This means, see, as the diagram shows, there are thin white lines all over the tongue, which divides the tongue into different smooth depapillated areas. This means the area which are covered by the white line are depapillated. They don't have any kind of papilla, neither filiform nor fungiform nor any papilla. Also, these serpiginous white lines change their pattern. They are not like this always. So that's why this disease is also referred to as wandering rash of the tongue, with the depapillated areas suggesting the outlines on a globe. So the popular term, geographic tongue comes here. Any particular etiology is also unknown in this, but it but it suggests, yeah. So geographic tongue usually comes in association with these stress, like psychological stress. Whenever a patient, like as it is written here, it comes in association with psychological stress, and also in the people who suffer from psoriasis of skin. It is a cutaneous disease. 1 to 2% of the population is affected. Coming to the histologic features, all the microscopic features of psoriasis are similar in benign migratory glossitis, geographic tongue, and migratory stomatitis. But obviously, these are not evident unless and until a biopsy is taken from a prominent serpiginous white line which is at the periphery of a depapillated patch. A thickened layer of keratin is infiltrated with neutrophils. Neutrophils are inflammatory cells which infiltrate the keratin layer as the lower portions of epithelium to a lesser extent. These inflammatory cells often produce microabscesses known as Monroe's microabscess. So basically what happens in this disease is the inflammatory cells, mainly neutrophils, infiltrate the thickened layer of keratinized epithelium, which produce small microabscess known as Monroe's abscess. Monroe's abscess is a keyword which you need to mention in your answer. It gets formed in the keratinous and spinous layers. Retiriges becomes thin and considerably elongated, with only a thin layer of epithelium overlying the CT papillae. When the retiriges are not elongated, this disease is considered as Reiter's syndrome. So it becomes a differential diagnosis. Differential diagnosis means the disease which appears same to be from the suspected disease. Chronic inflammatory cells can be seen in periodic acid shift stain, which can often demonstrate candidal hyphae and spores in the superficial layer of epithelium. So coming to the treatment and prognosis, no treatment is necessary for benign migratory glossitis. Only the proper oral hygiene and the scraping off of the lesion is sufficient. Thank you.